Good morning. My name is Jen Story. I'm a physical therapist with Mangiarelli Rehab. And I'm going to briefly discuss a postpartum or post-pregnancy issue that we can address in physical therapy. And it involves episiotomy, which is a surgical incision that is performed during the birthing process of a baby. Now, not too many hospitals do this procedure anymore, but occasionally they will surgically cut the tissue between the vagina and the anus to make more room for the baby to come through, especially if their shoulders are stuck in the canal. Recently, over the past, I'd say 20 years or so, this is done less often because it can actually have more of a traumatic effect, and it's a little bit more difficult to recover from, but sometimes it's a necessary thing to do. So the prevalence is probably less than 5% in most hospitals, but occasionally in some hospitals are a little more in the rural areas, it could be up to 30% performed on the mothers. So if the episiotomy is not completed, sometimes what happens is we just tear naturally during the process, and then a few stitches are put in place. However, it's a painful process for the first couple weeks during the healing. So a couple things the moms can do to help ease that pain is to use some ice. Just get an ice bag and sit on some ice. Sometimes that helps ease the pain. And to just perform a couple simple exercises. They're very low grade. It's not a lot of movement. It's just a Kegel. And it's just an exercise where you pull up and in around your vagina just to help initiate the soft tissue and the muscle to start working again, and it may help reduce some of that swelling and discomfort. This is something that is very gentle and subtle. You can do it in the first couple of weeks, and also you can pull up and in around the sphincters too, just to get those muscles to work more efficiently again. This is something that you can talk to your doctor about right after the labor and delivery to make sure that he feels this is a comfortable exercise for you to do. And if you have any questions or concerns about this topic, feel free to give us a call here at Mangiarelli Rehab.